What are the differences between complication, manifestation, extra-articular manifestation, comorbidity, and associated disease?
The disease spectrum of spondyloarthritis is a heterogeneous one, and therefore it is important to differentiate the musculoskeletal manifestation from extra-articular manifestation, as well as from complications and comorbidities. In an inflammatory disorder like axial SpA, it's important to differentiate inflammatory from structural lesions. Both can cause pain or stiffness, but the treatment principles are completely different. When looking at musculoskeletal manifestations, frequent symptoms of the disease are spinal pain, peripheral arthritis, dactylitis, or enthesitis. In some patients, axial manifestation is the only sign of the disease. Other patients might suffer from arthritis too. In general, pain, especially chronic pain, can be very debilitating. As I said before, one has to carefully look at the origin of pain to be able to treat pain properly. Physicians talk about extra-articular manifestation when the patient suffers from uveitis, psoriatic skin lesions, or an inflammatory bowel disorder. Extra-articular manifestation can add to the disease burden and is often linked to inflammation. However, inflammation in the organ can be independent from inflammation in the axial skeleton. In both musculoskeletal and extra-articular manifestation, complications can occur during the disease's course, for example, infections, fractures, or fistulas. It often requires a multidisciplinary approach. This is especially the case for complications which require an invasive procedure, like a spinal fracture or sometimes a cauda equina syndrome. The term comorbidity is used when physicians talk about diseases which occur frequently in combination with axial SpA. Examples are here osteoporosis or cardiovascular diseases like myocardial infarction or stroke. Patients can suffer from other diseases as well, for example diabetes, which we will formally call comorbidity, but which are not linked to SpA itself. Physicians should focus on comorbidities which are linked to an inflammatory origin, like cardiovascular disease, so that inflammation in the long run can be reduced or prevented, which will lead to a reduced prevalence of cardiovascular comorbidities. I'm not sure in which context my US colleagues will talk about associated disease. In my view, this can be inflammatory bowel disease, which we call the extra-articular manifestation, but also familiar Mediterranean fever, which can be linked to sacroiliitis as well.